Hello, I'm Dr. Anne Marie Prabulis, a maternal fetal medicine specialist and department chair of obstetrics and gynecology at Middlesex Hospital. Every year we welcome more than 1,000 babies, and we feel privileged to be part of each and every birth experience. We are here to ensure that you receive the safest, highest quality health care and best experience possible. We have outstanding providers who can care for you during your pregnancy and beyond. We can perform detailed level 2 ultrasounds and consultation for many pregnancy-related concerns right here at Middlesex Hospital. Thank you for taking the time to watch this virtual tour. Now I will let Amanda Laureano tell you more about the Pregnancy and Birth Center.
Hi, I'm Amanda Laureano, the nurse manager of the Pregnancy and Birth Center here at Middlesex Hospital. I'd like to take this opportunity to tell you a little bit about our unit here at Middlesex. Our unit is comprised of 20 patient rooms that are all set up to function as labor, delivery, postpartum, recovery rooms. You'll learn a little bit more about the LDRP model further in this virtual tour. We also have 2 operating rooms on our unit to ensure a quick surgical response when necessary. Our level 2 special care nursery has a capacity to care for up to 8 newborns at a time. We're also able to care for single births 33 weeks and above, and twin deliveries 34 weeks and above. Our exceptional team here on the Pregnancy and Birth Center consists of board-certified OBGYNs, pediatricians, APRNs, PAs, registered nurses, lactation consultants, patient care technicians, as well as clinical secretaries. All of our team members are here to provide you with their expertise and to make you as comfortable as possible throughout your stay. Teamwork and innovation are highly valued here at Middlesex Hospital. For example, we were one of the first hospitals in the state to utilize nitrous oxide for pain control in labor. We are so pleased that we still have this available as a choice for you during your stay. We welcome you to our Middlesex family and hope to make your birth story a memorable one. We feel honored that you have chosen us to be part of your family's journey. Please enjoy our virtual tour.
Welcome to the Pregnancy and Birth Center at Middlesex Hospital. My name's Alyssa. I'm the nurse navigator. I'll be assisting many of you prepare for your upcoming delivery. We are so privileged you've chosen us to be a part of your birth story. Today we'll be doing a tour of the Pregnancy and Birth Center. When you arrive here at the Pregnancy and Birth Center at Middlesex Hospital, you can enter through the lobby during the day or the emergency room at night. Our hospital staff members will guide you to the 3rd floor where the Pregnancy and Birth Center is located. At the entrance of the Pregnancy and Birth Center, our secretary will greet you. Or if she's unavailable, ring the doorbell to our main door, and one of our staff members will be happy to assist you. Our unit is locked 24 hours a day to ensure the safety of you and your newborn. Once on the floor, walk down the main hallway to our nurses station.
Hello everyone, my name is Carly. I'm one of the nurses here at the Pregnancy and Birth Center. I'm here to show you one of our rooms here when you're here for the labor process. So as you've heard, we are an LDRP. What that means is you'll be in the same room for your labor, delivery, recovery, and postpartum period. So we have a room that's set up here for the labor process. So I'll take you around a bit, kind of what everything looks like and what everything is here for. So this is one of our fetal monitors. When you come in, we'll hook you up to these. We'll be able to listen to the baby's heart rate as well as monitor your contractions. We can also take vital signs through here. We have a central monitoring system, which means when we're not in the room, we are able to see what you're doing as well as what your baby's doing at the desk. So we can always tell if baby is safe. So during the labor process, we really encourage you to keep moving and changing positions, and we provide a lot of resources and support for that. So a couple examples you see here are our peanut balls, which we have a lot of different positions that we can help you with. We have birthing balls here that we can use in the room, a rocking chair. We also each room has a private shower and adjustable shower head as well as a shower chair that you can utilize even while you're on the monitor. We do have ways to monitor you while allowing you to freely move about. During your labor process, should you desire pain medication, we have a couple different options. We do have pain medicine through your IV site, which does allow you to continue moving. We do also have anesthesiologists on call 24 hours in the hospital that can provide you with epidural anesthesia. So these beds are adjustable for positioning and comfort during the labor process, regardless of if you have an epidural or not. The bottom of the bed is also removable to aid in delivery. So once the long-awaited moment comes and your baby is here, we do encourage the first hour, the baby remains skin to skin with mom. Following that first hour that facilitates breastfeeding and bonding, we will take the baby over to our specialized warmers. We get important measurements and weights, and we administer medications all right here in the room, and we encourage the baby to stay in the room for 24 hours a day that we call rooming in. Among the resources we have here at Middlesex Hospital are classes to prepare you for the labor process as well as parenting. We do offer a childbirth class taught by board-certified childbirth educators to help you with the labor process. It also provides you resources for how your support person can help you through the labor process. Other classes we offer are newborn classes, breastfeeding classes, as well as exercise classes such as yoga and Pilates.
Hi, my name is Nicole. I'm one of the labor and delivery nurses here at Middlesex Hospital. We have 2 operating rooms in the Pregnancy and Birth Center to assist mothers that need to deliver their baby by cesarean. At Middlesex Hospital, we practice gentle cesarean, which brings attention to surgery being part of your birth plan. You can have one support person in the delivery room with you to provide support and comfort while you bring your baby into the world. To further support gentle cesarean, we can have music playing in the background of the surgery, provide a clear drape that can be lowered at the time of delivery so you can see your newborn immediately after birth, and when possible, we can initiate skin-to-skin and breastfeeding. After delayed cord clamping, your newborn will be brought to our specialized warmer where we will do a quick head-to-toe assessment, weight, and measurements. Your support person can join your newborn at the warmer until we are able to bring the newborn to you. Your nurse and the delivering team will be available with you in the room throughout the entire process. If at any time your newborn needs additional attention, we do have a special care nursery available.
There's a small number of children who are going to have a little bit more difficulty transitioning to the outside world. And that's why we have a special care nursery where we're standing right now, where we can provide a little bit higher level of care. And some of those children may be those who need help maintaining their sugar levels. And we will, as a team, work with you to develop a plan to perhaps learn how to hand express human milk or use our donor milk formula, or perhaps even an IV. So we understand that it's difficult to be separated from your child, and so we do everything we can to minimize that angst. And we have an iPad that you can have at your bedside and be able to see your child here in the special care nursery while your partner goes back and forth between your room and here at any hour of the day or night. Welcoming your child into this world and getting to take care of them for the first few days of their lives and teaching you how to care, feed, and nourish your child is our mission. Our infant care service is a team comprised of board-certified pediatricians and neonatally trained nurse practitioners and physician's assistants. And one of our team members is here on the floor 24 hours a day, every day of the year, just in case an emergency arises. So all of our children will get their newborn screening when they're about 30 hours of life. And that's to look for that very rare child who may have a cardiac or a hearing problem or a metabolic problem, because if we know about that, we can do something. Most of the time, one of our technicians will take your baby to a quieter room, especially for the hearing test. But if you wish, that can be done right here in your room. Now, for those of you having a boy, we can provide you with information about circumcision weeks or months before you deliver here or during your time, and we'd be happy to have a conversation about that. If you choose to circumcise your boy, please know that we do everything known in the literature to make your child as comfortable as possible.
Hi, my name is Megan. I'm a registered nurse at the Pregnancy and Birth Center. Regardless on how you choose to feed your baby, we are here to support you. All of our staff members are highly trained to assist you. Throughout your stay, you can expect our staff to support and educate you. If complications arise, a lactation consultant is available to assist you. Support is available even before you deliver with our prenatal breastfeeding class, as well as prenatal consultations with our lactation consultant if you have any specific concerns. After you are discharged, we have mom-to-mom support groups facilitated by a lactation consultant, as well as outpatient appointments. Following your delivery, you're able to get in touch with your nurse by using your call bell or by dialing the number that would be written on your board. If you had a vaginal delivery, you can expect to stay at the hospital for 2 to 3 days. And if you had a cesarean birth, you can expect to stay 3 to 4 days. Okay. Something everybody looks forward to doing is giving their baby his or her first bath. The World Health Organization recommends delayed bathing for 12 to 24 hours. You can anticipate your baby's first bath will be a swaddle bath. Swaddle bathing is a family-centered approach to newborn skin care. After your baby's first bath, you can relax back in bed and snuggle your baby skin to skin. After you deliver, your delivery room will turn into your postpartum room. Let's take a quick look at what it will look like. You'll have a private bathroom, a refrigerator, a bassinet for your baby with everything you'll need in it, a sofa bed that turns into a bed for your support person, a rocking chair, a television, and Wi-Fi so you can send your pictures of your new baby to all your friends and family. On the day of discharge, your nurse, pediatric provider, and obstetric provider will visit you to go over your discharge instructions to make sure you're going home confident and ready to begin your journey as a new parent. And as you leave, we'll do a few special things to celebrate the birth of your baby.
So every child is seen in their medical home, the place where they will be seen for the next many years, typically 1, 2, or 3 days after we discharge them from here. And that's going to be dependent on parental mood, feeding, and their risk of jaundice. Now, we are blessed with having many choices in this region, and you can choose a place for your child that is a pediatric practice, family medicine, or a combination. Our Middlesex Hospital Family Medicine residency offices in Middletown, Portland, and East Hampton, for example, are multidisciplinary with a combination of family medicine doctors, pediatricians, and OB-GYN. A pediatrician, like me, takes care of children up until around college age and have a little bit more specialty training, especially in children with special healthcare needs, whereas our family medicine doctors throughout the area can take care of your infant, you, your parents, and grandparents. So that's something to consider as you are choosing a medical home for this child. We are privileged to have so many choices in this area, and you have the ability to choose among many obstetric providers and hospitals to deliver your child in, and providers for your child. We thank you for choosing to trust us as the place where you're going to deliver your child, and we look forward to seeing you.
Thank you so much for joining us on the tour of the Pregnancy and Birth Center. Please visit our website for the most updated information about classes, tours, and more. We look forward to being a part of your birth story. See you soon.